is expected out here in this particular lecture class is that the head and neck region, we have, just like any other region, we have structures like we have bones, we have cartilages, we have ligaments, and as well as we have some structures which is related to these particular attachments of the bone. We call them as muscles, right? Which makes these particular actions on them. So all the structures which is present in this particular head and neck region develops from a particular developing structure. We call them as pharyngeal arch or pharyngeal apparatus. Pharyngeal apparatus is reversibly or kind of interchangeably called as branchial arch or branchial apparatus. They are kind of interchangeable words, pharyngeal arch and pharyngeal apparatus. Now, breaking down to the bones in this head and neck region, we are going to see some bones which is related to that particular cranium. We call them as neurocranial bones. That means which are related to this particular skull bones which is covering the brain region. Other is we call them as facial bone which is related to the face. And then we have some bones related to some of the organ present in the neck region, we call them as larynx. So we have these laryngeal bones and as well as cartilages. So bones and cartilages constitute a architecture in the larynx. We call them as laryngeal bones and laryngeal cartilages. Apart from that, we have a kind of special kind of bone present in this particular head and neck region which are tiny, very small, like microscopic or just like barely visible in eyes. We call them as ossicle. Now these are excuse me, ossicles. They are present in the ear. So we call them as ear ossicles. There are three tiny bones present in the mid portions of the ear. We call them as mid-ear ossicles. Three of them are there, Malleus, Incus and Stapes. So all these structures are developing in this particular region. That's what we have to know, where they are sourced from. These are your exam questions. They ask you with MCQs and with your narrative questions like where from this particular organ or where from these particular muscles have developed. Now coming to these particular muscles, if you go down to these particular muscles, in this region we have muscles related to this particular face. Now in the face region, we divide the muscle broadly into two terms. We call them as muscles of facial expression. That means whatever the grief, sorrow, pain we have, these particular things are making this work visible for us. If you are happy, elated, depressed, whatever things is there, these particular muscles are working on it and gives a visual of your mind state. Then we call them as muscle of mastication. So in the face region, you have two muscle set which are working two differently on two different parts. Apart from this particular face, we have important muscles related to this particular region. We have muscles in the pharynx. We have muscles in the larynx. These are important muscles. They are present in it. Apart from that, we have the muscles in the tongue as well. So we have these particular muscles present in different regions of this particular facial region and as well as pharynx and larynx over here. So we are going to learn these, where from these particular muscles are there and how these particular muscles are coming. That means the source element, where they are sourced, we have to know that. So this is what we are going to talk today. Now other than this, we have some tiny ligaments which are important, and of course we have some cartilages which are present in these particular intervening regions, that also we have to talk about, we have to know about. Now talking about these particular entities, all these structures, these bones, cartilages, muscles, ligaments are developing from one developmental structure. We call them as pharyngeal apparatus. So we call them as pharyngeal apparatus. Now this pharyngeal apparatus, as you can see, this particular name is a broad name. Under this apparatus there are three missions which are working. So there are three things present in this pharyngeal apparatus. We call them as pharyngeal arch, we call them as pharyngeal cleft, and we call them as pharyngeal pouch. So these are the three important structures or developmental contributes which together makes this whole operating signal. We call them as pharyngeal apparatus, and each of these arch, pouch, cleft contributes to whatever we have written to this side: muscles, ligaments, tendons, bones, cartilage, etc., etc. Now we have to know precisely what yields from this particular arch, what yields from this pouch, etc., etc., all these things. So this is our rather memorizing skill that we have to exercise whenever you are going through this particular development of these particular organs. And other than this, we have to learn about the soft tissue structures, like we have to know about this pharynx, we have to know about this particular thyroid gland, we have to know about parathyroid gland, where from they are coming and how they are contributing, or what are the subcomponents present within these particular glands that you have to know. Now, so breaking it down or making things complex with this particular pharyngeal apparatus. Now this particular pharyngeal apparatus consisting of these three things that we are seeing here: arch, cleft and pouch. Now to talk about this particular arch looks like a bulginess like this. So this particular bulgy structure that we are going to see subsequently, we call them as arches. Now between these arches we have groove existing. So these particular grooves we call them as cleft or pouches. Now, so this one we call them as arch. And in between these particular arches, this ingrowing part, we call them as cleft, or we call them as pouches. Now, which side we are going to call pouch and which side we are going to call cleft, that's what you have to know. Now, this particular arches is present in the midline, mid portion. Now, it has an outer side, and then it has an inner side. Now this one, which is an outer side, we call them as ectodermal side. Ectoderm means that is the skin feeling side. This is the skin side, and this pink, which is endoderm side. Now this ectodermal side, this particular region in between these particular arches, we call them as cleft. And then this endodermal side, which is present between the arches, we call them as pouches. So this basic architecture you have to know. Then we can just run through the slides that makes these things sensible as we are going through. Now this arches is the middle portion of the thing, which is made of mesoderm, and outer side is ectoderm and inner side is endoderm. So that makes this particular pharyngeal apparatus having an ectodermal side, endodermal side and a mesodermal side. So this is what we have to know. Now coming to this particular mesoderm, that means this arch is composed of the mesoderm. Now this mesoderm, we call them as intra-embryonic mesoderm. So this mesoderm, as we have seen so far in this particular developing region, is coming from two sources: paraxial mesoderm and lateral plate mesoderm. Now what do they do? paraxial mesoderm and this lateral plate mesoderm, they create the muscle, they create this bone, they create this cartilages, they create these blood vessels, anything and everything this connective tissue has, they are developed from this mesodermal tissue. And mesodermal tissue by and large is sourced from these two elements, paraxial mesoderm and lateral plate mesoderm. So these are the two things. Now in head and neck region, we have a special guest player. That's what you are tested with. So we have a contribution from an external source. We call them as NCC. Now this NCC is the important structure in the neck region. Now what is NCC? We call them as neural crest cells. Now what is a neural crest cell? The neural crest cells are ectodermal cells which are coming from the future brain regions. They migrate from the brain or brain developing region and migrate to different parts of the body. Now this neural crest cell or NCC also migrates within this mesodermal tissue of these pharyngeal arches, and they sit there and become these cells which is going to form these muscles, cartilage, ligaments, etc., etc. So this NCC is very important and it yields some structures in these regions of the future head and neck region. So this is the preface. So whatever things we have talked so far is the basic introduction. We haven't get into this system, but we have to know what we are dealing with. We are going to deal with the development of the face. We are going to talk about development of the neck region. We are going to talk about this particular development of the larynx, pharynx and structures related to it. And where from these structures are coming? Is coming to develop from this element. We call them as pharyngeal apparatus. Now what are these pharyngeal apparatus? These are tissues. What kind of tissues? They have three things together: ectodermal tissues, endodermal tissues and mesodermal tissues. Mesodermal tissues makes a bulge, we call them as arches. And on outer side of this mesodermal tissue, we have ectoderm that creates a groove in between, we call them as pharyngeal cleft. And endodermal side, we have this particular pharyngeal pouch which is present between the arches. And they together give rise to all the structures, bones, muscles, ligaments, etc., etc., that is present in our body. So this is what we are going to start with. So this is what we are going to learn: development of the pharyngeal arches, pouches, cleft and their development, and as well as the problem arising out of that, the developmental error, clinical problems. We are going to talk about the face, palate and various types of face and palate defects. We call them as cleft lip, cleft palate. These are very high yield exam questions in future life as well. Development of the tongue, of course we are going to learn. Development of the thyroid, abnormal positions of the thyroid, just like we talked about these particular testicles, abnormal positions of the testicles, we call them as ectopic thyroid. If some other place holds this thyroid, we call them as ectopic thyroid. We are going to talk about this parathyroid gland, very important tiny gland but enormous impact. And we are going to talk about the paranasal sinuses and teeth as well. This whole things will be covered and this is going to become black story. So we start with this particular element that we have talked with, pharyngeal arches. Now what do we mean by pharyngeal arches? You see that this particular embryo we are familiar with. We have this foregut, we have the midgut, we have the hindgut. Now we focus in the foregut region. So this is the foregut region. Now this particular foregut region, cranial most part or ahead most part is there. So cranial most part of the foregut, the mesenchymal tissue, that means this tissue which is present around shows some condensation, shows some areas of aggregation. We call these aggregations looks like this. Now this particular aggregations, between this aggregation they are kind of having depressions. So it looks like this in an embryo picture like this. So this particular structures looks like a short teeth. This is what is appearing in the future neck region of a developing embryo. So this bulges which you're seeing here, that's what we are referring here as arches. So this particular area which you are doing coming over here, they are known as pharyngeal arches, where they are coming in the cranial most part of the future foregut region. and this particular bulginess is appearing here. We call them as arches. Now, if you count the numbers of them, we see that there are 6 such arches are there. 1, 2, 3, 4, we are numbering them craniocaudally from the brain to tail. We number it. We call them as first pharyngeal arch, then second, third, fourth, like on. So we develop with 6 such bulges there in this future neck region. We call them as pharyngeal arches, 1 to 6. Now what happens? Number 5 drops off. So number 5 quits. So it disappears. So then we have this particular 5 pharyngeal arches. Now how we number them? Number 1, number 2, number 3, number 4, number 5 is absent, then 6. So we do not call them as 5 pharyngeal arches. We call them as 1, 2, 3, 4, and then 5 is absent, drops, and then 6. Clear? So if you have this particular bulges there, in between the bulges we have a depression. Now this particular depression, as I have mentioned, have got 2 sides. One is outer side, skin side, other is inside. The inside is inside this region. So I have split this region over here. This is what you are seeing here. This pharyngeal arch, which is a tube which is cut open, and you are seeing here this inside here. So this is inside, that means endoderm, and this is what you are seeing here is ectodermal side, outside. So outside from the skin, if you are looking from the side in the neck region, ectoderm side. Inside the mouth, endoderm side. So this particular tube is split open, and then you are seeing this floor of the mouth where you can see this tongue is developing, thyroid is developing, larynx is developing, like that. Clear? So this is the orientation of the things. Now let's look into a deeper dig into it. How does it things look like if you have progressed between this particular 5th week of life? That picture was there, the 4th week of life. 5th week of life, it's little bit have matured over here. So this region you are seeing again. So this embryo, this is the future head region, brain developing. This is the eye which is coming over. This is the heart which is going into this particular region. Limbars are coming, arms coming in this region. Now what you are going to do? We are cutting this particular embryo like this from the top and skim off. Just like chop this brain upper part off, partly. Now if you cut this thing, it creates this particular structure. Now what you are seeing here? This is the brain side which you are seeing here, future brain region going to have these particular cerebral vesicles. And this is what you are seeing here is the spinal cord side, back side. So this blue, what you are seeing here, the brain or neural tissues. Now in between what you are seeing here, the cavity. Now you are seeing this outer side cavity, this is the inner side cavity. What you are seeing from above, from this window above, this cavity of the future mouth region which is going to develop. So this is the tongue which is developing in here, and this is the larynx, laryngeal region which is developing here. In between what you are seeing here, that is our point of focus. We are looking into this bulginess, 1, 2, 3, 4, 5, 6, like that. So this particular bulges, right side and the left side, there we call them as pharyngeal arches. Now this particular pharyngeal arches, outside to it, covered by this particular blue lines. In between them we have a groove. We call them as groove as pharyngeal cleft. And inside, which is the yellow side, endoderm line region, we have same region, out pocket over there, we call them as pouches. So pharyngeal arches, pharyngeal clefts, and pharyngeal pouches. So one is ectoderm, one is endoderm, and the brown, which is the main bulk, which you are seeing, the arches is mesoderm. Clear or not? So all these elements, pouches, arches, and the clefts, going to produce whatever the structures, muscles, ligaments, bones that is required in the head and neck region. Clear? So this eventually gives rise to all the structures in the neck region. If you have any error in developing them, we have this developmental problem. Now what is deep inside? Now you focus this brown tissue now. That brown tissue which you are seeing here in between, we call them as arches. How many arches are there? 6. 1 drops off. Which one? Number 5. Then we are left with 5 of them. 1, 2, 3, 4, and then 6. So 6 arches are there. When we number it like that, 1, 2, 3, 4, 5 is absent and 6. Clear? Now within this particular arches, you zoom it. Follow each of these arch. For example, this is arch number 1 and this is arch number 6. Within them, we find 3 dots. One is red dot, one is blue dot, and one is the green dot, yellow dot. Now what this means over here? We have the vessels. We have the veins, arteries and the nerves. So each of these arches have their own nerves, have their own arteries and veins. So each of the arch, that means the brown tissue, what they mean by brown tissue? We have the mesoderms. Mesoderms means the lateral plate mesoderm contributes to it, paraxial mesoderm contributes to it. So far we have seen. Now out here we have a special player. What this special player is? NCC. What do you mean by NCC? Neural crest cell. Don't forget about it. This is MCQ that you are going to be surfacing in examination till you just like clear this final exams and till you clear this particular like entrance exams. And neural crest cells will be everywhere. Very, very important MCQs that is figured on MCQs. But anyways, coming back to this, we have the artery nerves which is coming in here and that is going to form this particular, are going to feed each of these particular arches in this region, and whatever the structures are coming over here, it will be produced from there. So this is what we are familiar with. Now this is that we are learned here. So all these arches, pouches and the grooves together we call them as pharyngeal apparatus, and what they are going to do, they are going to produce all the important structures, muscles, bones, ligaments, whatever the things we have is coming from these structures contributing together, contributing in synergy together to give rise to the head and neck region structures. Now coming back to this, what you are coming over here, the mesenchyme or mesoderm. So here we have the important thing. We have learned so far mesoderm is coming from 2 sources. One is paraxial mesoderm. By the side of the notochord, the mesoderm is coming, going to give rise to muscles, bones, etc., etc. Lateral plate mesoderm, which is coming to form body, which is present in this particular body region, ribs and etc., etc., muscles in this like abdominal, anteabdominal wall, thoracic wall coming from the lateral plate mesoderm. Now here we have a special player. What special player we have? The mesenchyme is infiltrated by a special player. We call them as NCC, neural crest cell. Now what this neural crest cells is yielding or producing in the neck region, that is what your exam question is about. So this neural crest going to form some bones, and what bones? We are going to learn that. So this lateral plate mesoderm is going to form some cartilage and bones. What this lateral plate mesoderm is yielding in the bones and cartilages, that's what you have to know. This paraxial mesoderm is going to form some bones in the head and neck face region. What bones is coming from it? That's what you have to remember. So this next picture basically flashes here. Whatever the things is coming from the neural crest cells, whatever coming from this paraxial mesoderm and lateral plate mesoderm. You see that 3 different color codes are used. The front one, the blue one, is coming from NCC. These are your exam MCQs, these are your exam questions. So this frontal bone, nasal bone, zygomatic, these are all things which you are seeing here derived from what? NCC, neural crest cell. They are your exam question. They ask these particular questions about where from they are sourced. What is neural crest cells? They are developing ectodermal cells. Where they are coming from? They are coming from brain region where the brain tube is developing from their region, migrating out, spreading all over the body. Some cells comes into these arches, settle down to form this element, frontal bones, part of the sphenoid, temporal bone, etc., etc. What this red bone is there is derived from paraxial mesoderm. That means by the side of this particular spinal cord, this particular paraxial mesoderm, that particular mesoderm contributes this part of the bone. Occipital bone, this particular bone, we call them as parietal bone. They are contributed from this. And then we are left with lateral plate mesoderm. So what this lateral plate mesoderm is there? Only yielding over here, these laryngeal cartilages. They are derived from lateral plate mesoderm. These are all your MCQ questions. You will forget and fail to answer this, you will be losing marks. In a final exam, you know, there will be no cross talking. You will be examining and sitting in front of the camera, which can catch these audio voices and as well as the visuals. So the examiners or the observers are all over West Bengal will be poking on you. This guy is talking, move, this guy is not talking, this guy keep aside, like that. So they will be giving instructions from remote places. We cannot do anything about. It's not funny thing, it's a real thing. I am not making up stories. You can ask, check in with your seniors. So checking with this particular MCQs and the exam questions is not going to happen. Trust me. That's why you have 100% failure out of 150, 40% failure out of 100. So this is what your exam question is about. Neural crest cell, NCC. Now digging deep into each of these components that we have started with. Now you have any doubts about pharyngeal arches, pouches and cleft? All are clear with? What do you mean arch, pouch and cleft? What is ectoderm? What is endoderm and what is mesoderm or mesenchymal tissues they are, right? You are good, right? Okay. If not, help yourself. As I am saying, these particular arches have got their own nerve supply, their own blood supply, and they yield some things that is deriving of it. Now, how many arches we have? 6 and then 5. So finally we have 5. So dealing with 5 students out of 6. Now each of these pharyngeal arches is going to produce some muscles, and whatever the muscles that are going to be produced from that arches will be supplied by the nerve which is feeding this particular arch. That means for first arch we have a nerve. We call them as nerve to first arch. We have an artery, we call them as artery to first arch. Clear? So how about arch 2? We have a nerve. What nerve? Nerve to arch 2. We have an artery. What artery? Artery to arch 2. Likewise 3, 4 and 6. Clear or not? They don't mix up. They don't change. They don't overlap. So they follow the strict rule. Now what these arches are going to produce? They are going to produce muscles. They are going to produce bones. They are going to produce some cartilages, whatever the things are coming. So if first arch is producing a muscle, which nerve will be supplying it? Nerve to arch number 1, not arch number 2. Clear or not? This is very clear about their roles. They don't overlap. Alright? So for each of these arches, we have an artery, we call them as first arch artery, second arch artery, third arch artery likewise. So the first and second arch artery largely vanishes, only we have a little remnants there. Third, fourth and sixth, they have a significant contributions in adult body. So we are going to see this, right? So likewise the nerves. So for the first arch, we have a nerve which supplies here, which is coming from V, trigeminal. So the first arch nerve is 5th cranial nerve. That means trigeminal is the 5th cranial nerve, is going to supply all the muscles that is produced from the first arch. No one else. No helping line. So whatever the muscles are coming from this first arch will be supplied by branches of 5th cranial nerve, trigeminal. We call them as mandibular divisions of the trigeminal nerve. We have 3 divisions. I am not going to talk about the divisions right away, but trigeminal nerve is good enough. Likewise, the arch number 2 has a dedicated nerve. So that arch number 2 nerve is the 7th cranial nerve. That means facial. So whatever the muscles that is going to be produced from arch number 2 will be supplied with the branches from facial nerve. No one else. So what our role is there? We have to know what muscles are coming from arch number 1 and then nerve supply to it is easy. Trigeminal. Whatever the muscles coming from arch number 2 and their nerve supply? Facial. That's easy. Clear? So this is how it is coming. So This is how they look like, arches. They looks like a bulges over there. They have the nerves coming from there and strictly supplying that particular region. Say follow that. This particular arch number 1 is trigeminal nerve, which is going to give over here mandibular branch. Ignore the mandibular branch now. Trigeminal nerve. Arch number 2, facial nerve. Arch number 3, glossopharyngeal. Arch number 4, coming from this region, 4 and this 6 together, coming from 2 branches of vagus nerve. Recurrent laryngeal nerve coming from below, and vagus, which is coming from another branch, we call them a superior laryngeal nerve. So they are branches of vagus nerve together. So superior laryngeal nerve and this recurrent laryngeal nerve going to supply this muscle which are coming from arch number 4 and arch number 6. So this is what you have to know. Now if you know the nerve supply to the arches, what you have to do again, the muscles arriving from that particular arches. And then if you know the muscles, then we have to know about some cartilages if they are coming. We have to know some ligaments if they are coming. We have to know some bones, muscles, etc., whichever the content is yielding in here. That's what we have to know. So we take one arch at a time and learn it. Likewise the nerve, we have dedicated blood supply. We call them as first arch artery, second arch artery. How they look like? They come from this particular brain region, dorsal sac of the aorta, from the developing heart, dorsal sac of the aorta. They have 2 branches, and from the 2 branches, right side, left side, they create these arch arteries like this, 1, 2, 3, 4, 5, 6, and 5th one obviously don't have arches, so it also vanishes. Likewise this particular arch itself. So we have the first arch artery, second arch artery, third arch artery, 4th and 6th. And out of this 1 and 2, in adult we have a very little contribution. So one is going to form the maxillary artery, other one is going to form a tiny artery, we call them a stapedial artery. But they are tiny, but even they are big yield for your MCQs. So this tiny one often cures the problem. So we have this first arch artery, and how they persist in adult, that's what you have to know. The fate of these arteries are your all MCQ questions. So first arch in adult, what happens? Eventually this arch is grown, full grown. After that, what happens to the artery? It makes a little contributory, this external carotid artery, we call them as maxillary artery. What happens in adult? The second pharyngeal arch artery, it largely disappears, only contributes in adult. After this development is over, creates a tiny artery, we call them a stapedial artery. These are the 2 tiny contributory artery, but high yield for your MCQs. Now, third, it forms this particular common carotid duct and the beginning of the internal carotid arteries. So this partly form the carotid artery right side, left side, and part or beginning of the internal carotids. 4th and 6th, they contribute a large contributions in our adult bodies. The fourth one creates this particular middle portions of the arch of aorta. So the arch of aorta have got, like after ascending the arch of aorta, it has a tiny middle portion. That middle portion from the left side is forming, and the right side form this beginning of this subclavian artery. The beginning part of the subclavian artery on the right side, and the left side it is forming this particular left arch of aorta, middle portions of it. 6th one, which is going to form the pulmonary artery and this ductus arteriosus, which eventually becomes ligamentum arteriosum. So this is your contributory branches in adults from this artery. What does it mean? So they feed these particular arches when they are growing. Now once these things are full grown, that large wholesome arteries no longer required in the full strength. So they shrink, they regress, they readjust and accommodate themselves. How do they accommodate? These are the way they accommodate. So this chart that you have to keep in mind for your MCQs. They ask these MCQs based on this. Clear? So these are the fate of these arteries, and you have to know they are feeder arteries and they feed this particular each arch, and eventually they form in adult these structures. That's it. Now coming to the complex part of this pharyngeal arch. Now before that, we take a pause to talk about this, whether you understand this arch or not, whether you understand this pouch or not, whether you understand cleft or not, whether you understand mesoderm, whether you understand this ectoderm and endoderm. and what are the numbers of the arches we have, and to start with, how many of them are there in this particular developing phase, right? What are the fates of these arteries? That means each of the arteries they are there. What are this particular arch is fed with these nerves, cranial nerves, like 5th, 6th, 7th, 9th and 10th, 2 divisions, and this particular arches to this and what they are yielding in. So you have to know about this, clear about this before we move to the next part. Now how these exams will be coming in examination. In examination, last time in the supply exam, they asked the question about define pharyngeal arches and give an account of derivative of first arch derivatives. That means whatever the structures that is developing from first arch, they wanted to know. So name it down like that. So they has a 5, 1 and 4. That means 5 mark questions were there, right? So this is what we are coming in to this fate of this pharyngeal arches. Now remember that we talked about 3 entities: arches, clefts and pouch. We have to talk individually each sections of them. So we have to talk about the arches and what yields from there. We have to talk about these pouches, what yields from there, and likewise the clefts. So each of them are contributing separately, differently in these regions on the head and neck, and each of them, every of them, either MCQs or the theory question. So this is what we are going to talk at the beginning part. This is what we are going to end with, the fate of this pharyngeal arch number 1. Number 1 is going to make what? So this is what we call them as first pharyngeal arch. We also call them as mandibular arch. So what they're going to make? They're going to make some muscles. What they're going to make? They're going to make some ligaments. What they're going to make? They're going to make some cartilages if they are. Alright? So that's what we are going to talk. So they are going to yield some cartilages, we have to know. They are going to make some muscles that we have to know, and nerve supply to it. Now first the easy part, the muscles. So first arch give rise to the muscles which is sitting on the face, and this muscles which is present coming from first arch is going to give the muscle of mastication. That means whatever the muscles of mastications are, or whatever the muscles of mastication that we have, they are derived from first arch, trigeminal nerve. That's it, easy part. Now complex part. Besides this muscle of mastication, they give some more. And what more? That's what you have to know. We have a muscle, we call them as digastric. Digastric has 2 bellies, anterior belly, posterior belly. The anterior belly of digastric is coming from it. There is a muscle present in ear. So that particular muscle is supplied by this. So tensor tympani, this is an ear muscle present in the middle ear that is coming from first pharyngeal arch. There is a muscle in the palate, we call them as tensor palatini, that is coming from first arch. Muscle of mastication and anterior belly of digastric, all are your MCQs. And their nerve supply to it. So whatever the muscles, they are coming from first arch, you have to know the names of them. Nerve supply, easy. Clear? So this is what you have to do. This is why we call them as derivatives, coming from the muscle derivatives. So muscles are yielding from this region. Second part, complex part, going to make some cartilages. From this cartilage, they are going to make some bones, going to make some cartilages, ligaments, etc., etc. The prime thing which is coming from first arch is mandible. That's why you call them as mandibular arch. So this mandible is derived from first pharyngeal arches. That's not the only one. Apart from this particular mandible, we have little bit contribution coming from this maxilla, that maxilla upper cheek, upper jawbone, and as well as this zygomatic bone, zygomatic arch. They are also coming from this region. And along with that, we have 2 tiny ear bones, ear ossicles. That too was coming from this particular cartilages. So these cartilages coming from, or bones which are coming from this bone as this temporal bone, maxilla, zygomatic bone with the arches, and then we have this small ear ossicle, Malleus and Incus, and they have 2 ligaments attached to it. We call them as ligament of Malleus and we have a ligament, we call them a sphenomandibular ligament, coming from the sphenoid to the mandible, and then whole of this mandible, it is coming from first arch. So many things, and all are your MCQs. So the first arch is taking heavy load, muscle of mastication, antibelly of digastric, tensor tympani, muscle in this palate, tensor valli palatini, antibelly of digastric, they are coming from all of them. Along with that, nerve supply is easy, cartilage and ligaments, they have many. Mandible, to note this first one to start with, then go to this cheekbone, maxilla, the zygomatic bone, then go to the ear ossicles, Malleus, Incus, and the ligaments of the Malleus and sphenomandibular ligament, which are kind of coming from this particular contributory element. So this is what we have to know. We call them as derivatives of first arch. Likewise, the second arch will be coming, third arch, fourth and fifth. Eventually, they are coming home. So summarily, we have to know this, what we have to talk. Mandibular arch, first arch, going to form this particular muscle of mastication, these muscles. And then, these are the bones and the cartilage and ligament, they are coming. So this exam, they wanted to know this only. See, if you have written this picture only, up to this, you have 4 marks out of 4. And only 1 mark left to define what is pharyngeal arch. 5 out of 5, you can easily get out of it. Likewise, in exam, they give the same question, giving that same thing, second arch derivative. Could be the third arch, fourth arch, fifth arch. So this is how they are going to ask the question in examinations. So we talked about this particular arch or first arch derivative. So cartilage is coming from here, muscles coming from here, nerve supply to it. And the blood supply, which is first arch artery, becomes in adult maxillary artery.